Hi, I'm Omar Hamada, an ER physician here at Cookeville Regional Medical Center. That's a really good question. My maternal grandfather was a physician. My grandfather really particularly influenced my life when I was young. And I always knew that I wanted to be a doctor, to help people, to basically give them the message of hope and healing. I think here in America we have confused medicine and healthcare, and I think they're two separate things. Healthcare is really the business of providing medicine or healthcare, but medicine is really the message of hope and healing that physicians give to their patients, and that's really why I went into it. One, I love the science, and it's a continuing learning process that never stops, but also I love my patients and the ability to help them get better, feel better, and get healthier, teach them how to take personal responsibility for their own health, and then when the time comes, being with them and their families as they pass on. So it's, I think, a very high calling that I feel honored to be a part of. It's really interesting. When I first started medical school, I thought I was going to be a cardiothoracic surgeon. I'd read Christian Bernard's book, One Life, which was his autobiography. He was the guy who did the first heart transplant in the 60s over in South Africa. But by the time I got to med school, I had transitioned and thought I was going to do neurosurgery. But through a long story, I ended up doing family medicine, and it's been a great field. But I got frustrated because I missed the OR. So, of course, then ended up in OBGYN as well. But in the midst of that, as I said earlier, I was in the military too. And what the military provided was a sense of training and leadership, adventure, and also gave me the ability to serve our country. But what it provided medically in the Special Forces and the Green Berets was exposure to austere environments, very high altitude environments, deep sea environments, wartime combat medicine environments. So basically left us in the field with very little resources, trying to manage people who were in dire straits. And that really helped me develop a love for emergency medicine, the ability to care for people in an emergent situation, sometimes with very, very few resources. So it taught me a lot. And then when I transitioned back to the US and civilian work, of course, then I found it very easy to be able to work with all the resources that we actually have in modern hospitals in the emergency departments. So that's really, I think, what got me really interested in emergency medicine. One was family medicine. That was part of our training, and it was longitudinal. And throughout our family medicine training, we were in the ER. But particularly, I think my exposure in the military got me really keyed into it.